Thank you for viewing our poster on a customized triggers program, a tertiary care children's hospital experience. We are from Children's National. As we know, medical errors are a significant cause of patient harm, and despite an increase in patient safety programs across the nation, we as hospitals need to continue to innovate in order to improve patient safety and reduce harm for our patients. Traditionally, this has been accomplished by relying on passive voluntary safety event reporting. However, the literature shows that these types of programs can be constrained by inequitable underreporting and the limited ability to truly improve real-time care based on its retrospective nature. To combat these challenges, trigger tools create an opportunity to improve patient safety by proactively surveying for potential harm. Our triggers program was first created in 2013 off of the IHI Global Trigger Tool. However, in 2018, it became clear that there were concerns for clinical usefulness of the triggers program due to broad report logic, creating many false positive triggers, feedback of frustration among end users, and therefore limited adoption in our organization. In response to this, our global aim is to increase program usability. Specifically, we aim to increase overall trigger signal from 8% to 16% and sustain for 12 months. Trigger signal, which is our primary outcome, is a novel term that we created in order to help quantify the clinical usefulness and overall development of the program, as there's not currently literature that describes this information. It's defined as the percentage of cases that are identified automatically by the triggers program that represent a true occurrence of a targeted event. Here on the bottom left, we have our key driver diagram that focuses on the overhaul and restructure of the program with interventions that relate to our key drivers. For an overview of our interventions, we began with the creation of a link between the two departments of process improvement and clinical informatics. For improved stakeholder engagement, we work heavily with the end users to create an established trust on the logic that's being built and the data that then comes out of the report. All new triggers are now built with a healthy intent platform, which is a Cerner-based platform that pulls from the EMR. Additionally, we now have collaborations between triggers and specific committees that have identified a need for a particular area of process improvement. Since 2018, we have expanded the program from 6 triggers to 11. Our control chart on the right showcases the changes in our program with interventions as PDSA cycles listed in the boxes. Incident reports linked to triggers, which is our secondary outcome, have increased from 9 to 188 in 2021. Overall, Children's National's program highlights the successful evolution of a tailored approach to increase clinical usability of a trigger tool. Utilization of programs that are quasi-real-time and iterative require a customized approach rather than a one-size-fits-all static paradigm to drive patient improvement.